Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Good day, everyone. I'm Hazelline Leslie Buenaventura. I'm a theater staff nurse here in Northern Ireland, United Kingdom.
Sometimes nurses attend our London courses from as far away as Glasgow, Cardiff and Portsmouth. Thank you. Sometimes nurses would like to attend our outstanding OSCE courses but for various reasons can't make it here. It's okay, we hear you. Here at IELTS Medical, we're currently working on reaching every nurse wherever you are in the world. In the meantime though, we've got our video course and textbook package called the Ultimate Guide to the NMC OSCE. Your guide includes the theory for the exam, as well as vouchers for 1 or 2 6-hour sessions with our OSCE educators. Grab your ultimate guide at oscenurses.com today.
Man knows best.
Patient care, you're more focused with the patient care. I believe other nursing positions, like for example, being in the ward, you can have like 4 or 5 or more than patients. But in the operating theater department, it's really focused because one patient at a time. Or is, I think it's really a rewarding experience. Just I don't know with anyone else as a theater nurse.
Sure. Yep. Yep. What about? Exactly the same. You plugged it in and recognize the instrument. Yep. Let's do it.
In my case, when I was still a nursing student, I really love anatomy, and it really gives me the opportunity to see what's really inside the body. And for example, the patient has abdominal pain. You will think, why is this the patient has abdominal pain? And then whenever you're inside the theater, you will see, oh, that's why, because the patient has a bowel obstruction or the patient's appendix is already inflamed. So it's really, you can see more of the picture of what's really happening inside the patient's body. And I think that experience or that opportunity is very rewarding for me. And letter O, opportunities here are tremendously great. There are a lot of variety of roles here in theater. I think there's a stigma here in theater nursing that you're just the assistant of the surgeon. You're just standing beside the surgeon, giving the instrument, and that's it. That's the end of your job. But little they know that here in theaters, there's a lot of opportunities. Being a scrub nurse, it's not just merely memorizing the instrument or the steps of the procedure, but it's more on familiarizing yourself on what's the purpose of this instrument. And also, you need to advance your skills. You need to deal with different kinds of surgeons, their preferences, different kinds of surgeries. As I mentioned, there's a variety of surgeries here. You can deal with gynecology, urology, general, trauma and orthopedics, eye surgeries, ENT and max facs. So there's a lot of aspects in surgery. And you can also do anesthetics. Like here in the hospital I'm working with, they offer free education as an anesthetic nurse specialist. And this more focused on airway of the patient. And you'll be dealing with how to navigate or how to give the patient the proper equipment or what is needed to secure the airway during the surgery. And also, you'll be more familiar with the drugs that needs to be given during the anesthetic phase of the patient's journey for the surgery. And also, you can be a surgical care practitioner. You can be a specialist care nurse for urology or for gynecology. So there's a lot of variety of roles that they can offer here, and it needs a lot of training. It's especially for the equipment that you're using, the instruments, and any kind of materials that might be needed for the whole surgery, and not just merely dealing with the patient. So a lot of roles in here. And you can develop your skills. So you'll be working under pressure, and then you'll be developed to be calm under pressure because you were trained to think immediately in that short period of time inside the theater. Because in theaters, every minute and every second is really important.
Man knows best.
C is the communication barrier. there's a lot of communication barrier in theaters, especially you're wearing a mask all the time. Even just before the pandemic, most of the cases were always wearing masks. Very hard to understand what is needed for the surgery. And also the surgeons here, they're not all locals. Some came from different regions of the world or different parts of the world. Some came from India or Egypt. And then the way they speak English is clear enough, but the way you understand it, sometimes it's different. Letter O for the drawback. It can be an overwhelming experience. Of course, it's a rewarding experience, but it can be overwhelming as well. As I mentioned, you're working long periods of hours, and then you're standing on your feet all the time. And I have this example that I was recovering for a bowel surgery, and it's from 8 in the morning until 8 in the evening with no rest at all. So it can be physically demanding and exhausting. And then N, the nursing skills cannot be fully utilized. When I said nursing skills, it's the bedside nursing skills. Inside the theater, you're not all the time giving the medication because the doctors are giving the medication, or most of them, especially the anesthetic doctors, checks the cannula or they do the cannulation. And you can have that skill, of course. You can do it sometimes if it's needed, but it's not every day that you do it. It's not every day you insert a Foley catheter for a patient, or it's not every day that you do drug medication assessment in theaters, because you're dealing especially with the instruments that needs in the surgery. So I think that will be the negative side, that you're not practicing your skills every day. Or if you're dealing with tracheostomy patient post-op, you'll not really be able to practice it inside the theater. And then letter S, shorter period of time for interaction with the patients. Before the patient will be put into sleep or before they will receive anesthetic agent, it's probably 15-20 minutes that you're just talking with the patient.
Man knows best.
So it's from 8 in the morning until 6 in the evening for 4 days. So sometimes Monday, Tuesday, Thursday, Friday, and you're off on Wednesday. But after several trainings, we do rotations here in theaters. So in my case, I started first in general for 6 months and then trauma for another 6 months. And then before you're able to do some C-pod shifts, as they call, that means you'll be in the emergency theaters, you'll be doing weekends, long days, holidays, or nights. You need to be more familiar first with all kinds of surgeries, because anything in emergency will come. Of course, it's an emergency theater, broken mandible, broken bone, or bowel surgery. And so in my case, I was able to do more trauma weekends because I had that training when I was still starting.
The night shift.
So now I'm doing night shift, I'm doing holidays, and also weekend long shifts. And I believe some people will tell that the salary is not that high compared to a bedside care approach. Yes, that might be true in some part. But if you're dealing more of choosing on what you really wanted to, I think the salary will not be an issue for you. And as I said before, it's a good training here, and you can also do some night shift or weekends.
Man knows best.
To give my advice using the acronym din po as a nurse, NURSE. So N is never underestimate your skills. I believe if you've been used to working in the ward, or for example in an outpatient department or any environment that except for theaters, you will think, is theaters really for me? But never underestimate your skills, because here in the UK, they give trainings. I have colleagues that they don't have experience in theaters. Maybe it will be different in my case because I have experience in theaters in the Philippines. But I have colleagues that zero experience in theaters. And then now they're doing orthopedics, they're doing, some of them are already in charge in theaters. They are already as a team lead. So because of the opportunities and trainings in theaters, you will develop those skills. So never underestimate, especially for us Filipinos. We can always adapt to changes. And then U is uprightness at all times. I believe it's not just in theaters that you have to be really honest at all times, especially but here in theaters, because you're dealing with the swabs or anything that may go inside the patient's cavity. You always have to be honest on, like, for example, with regards to the counting, if there's missing, or if you're not sure of the procedure itself, you can always ask, you can always be honest to what is really inside your mind. And then R is respect all your colleagues. I think in all kinds of industry, in all kinds of profession, you really have to be respectful. Uh, because you will never know, you can be a patient, might be a patient, or one of your relatives might be a patient, and then your colleagues will be dealing with that, with your relative or with you as well. So I think if you will develop that respect with your colleagues, it will be really good po na to develop you as a person as well. And then S is self-reflection. Most of the time you will think na you're exhausted or burned out in the ward. To be honest, that's what I've experienced before when I was working in the ward. And you need to do handovers, and you need to wait. Sometimes your shift will end at 7:30, but you will be home 9 o'clock or 8:30, because there's a lot of patients that you need to do handover. But here in theaters, we don't do handovers except after the surgery. Very short handover. What is the post-op plan? What happened to what is the surgery itself? So because of self-reflection, I was able to really understand that I really love theaters, but it's not for everyone. So if it's not for you, you can try, but if it's not for you, you can always go back to what you really love to do. And then E is always embrace your flaws and embrace changes. You cannot do multiple tasks at one time inside the theater, because as I've mentioned, you have to be focused or be concentrated on one task. If you're a scrub nurse, you cannot do circulating nurse. If you're a circulating nurse, you cannot be focused on the surgery all the time, or the being a scrub nurse. So always embrace your flaws. If you don't know anything, you can ask. And don't always pretend na I know this procedure. If you're not happy, they do second scrubbing here, especially if you're junior sa theater. They will ask you na, are you happy enough to scrub by yourself? If not, we can just stand, or we can support you. The support system is really good, I believe, in theaters, because you're dealing with the body cavity of the patient. So hopefully maging theater nurse din po kayo, and see you in theaters, future colleagues.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.